Hi and welcome to Lessons from the Grand Rounds. From this video, I'm going to start a transplant series from the students' perspective or the student edition, where I'm going to discuss about few basics of transplant, and then we'll jump from basics to some moderate information. Then we'll be discussing about rare things also. This is an introductory video where we'll be discussing about basics of conditioning, and we'll be discussing one of the high dose chemotherapy agent, that is Busulfan, in this short video. So in general, when we talk about stem cell transplant, we have the conditioning regimen, then the stem cell infusion, and then we wait for the engraftment. Um, and here the conditioning regimen has evolved from since the last 40 years. So we have very good conditioning regimens now for different indications. So what is a conditioning regimen? So conditioning regimen has few functions. One of them is to create space in the marrow by myeloablating. So by ablating the marrow, it creates space for the new stem cells to reside there. And it also includes a drug which uh, cause immunosuppression so that the graft mm, is there smoothly, and there is it in short prevents graft rejection. And you'll also have the conditioning regime, will also have the GVHD prophylaxis also. So the components of the conditioning regimen in short includes a lymphodepleter, a myeloablating agent, drugs which also cause immunosuppression, and then you'll have the GVHD prophylaxis after the stem cell infusion. So for example, fludarabine is a lymphodepleter. In myeloablating agents, you have alkylators. You'll have TBI, which also plays a role of ablation, as well as for a GVHD prevention, you'll have also have ATG as a conditioning agent, and then in GVHD prophylaxis, you have multiple agents ranging from mTOR inhibitors to MMF to methotrexate and post-cyc, or the post-transplant cyclophosphamide. So here, uh, in general, the conditioning regimens are divided into three categories. The first category, the conventional, was myeloablating um, conditioning, that is MAC. Very previously used, now also be used when you want a good remission in a disease positive status, or when you're taking patients in positive MRD positive status, and that had significant toxicity. We have moved from MAC to RIC now, which is reduced intensity conditioning. In subsequent videos, I'll also tell the exact difference between when you call it as myeloablative conditioning MAC and when we call it as RIC. In RIC, we have the recent and the most commonly used protocols, conditioning protocols, are RIC, and then you have the non-myeloablating protocols, conditioning and MA conditionings, where we are using it for benign conditions. So we have divided conditioning therapies into MAC, RIC, and NMA, and we know the components of the conditioning regimen. So we'll discuss about Busulfan. So Busulfan belongs to the group of alkylators. So these alkylators, what they do is they damage the DNA by alkylating the guanyl residues of the DNA adducts, and this causes defects in the DNA linking, cross-linking defects, and there is damage to the DNA, and this is how they work. Busulfan is available as oral, IV as well. The oral overall distribution and the bioavailability is variable. That is as low as 10 to as high as 100%. So that is why with Busulfan having a lot of interaction with the other conditioning agents as well as other supportive medications, a lot of centers use IV Busulfan to improve bioavailability. That is one of the reason, and most of the centers are using IV Busulfan. So where do we use Busulfan as a conditioning agent? It is a good alkylator and good myeloablating agent. So it is used in conditioning regimens in benign like thalassemia transplants. We use fludarabine, Busulfan, cyclophosphamide, ATG. Okay, so Busulfan works there for myeloablation, and we use there. And the second conditioning where we use second indication where we use is myeloid neoplasms, which includes AML, MDS, CMML. So in these conditions, we use busulfan as a myeloablator. So what are the notable side effects? First is myelotoxicity, which we want here to remove the marrow, ablate the marrow, and the other side effects include, so clinically when you have regimens including busulfan, we pre-medicate and keep a lot of antiemetics in on flow, because these patients have significant nausea, vomiting. The other side effect, the third side effect includes mucositis. So when you give in conditioning around day 7, day 8 post transplant, patients start developing oral mucositis, upper GI mucositis, and perianal mucositis, lower GI mucositis. Typically is oral mucositis. Significant grade 3 oral mucositis is seen with busulfan when you're using it for 3 days. The other notable side effect is seen in 5 to 10% patients, that busulfan precipitates grand mal seizures or GTCS. So here we pre-medicate and keep the patients on levetiracetam as a prophylaxis till day plus 2. So the other important side effect regarding busulfan is veno-occlusive disease or sinusoidal obstruction syndrome. Here the risk of VOD increases when you're using the other alkylators as well in the conditioning. For example, if you're using cyclophosphamide, you're using melphalan, you're using thiatepa, for example, a conditioning where you have uh, apart from busulfan, we have cyclophosphamide and other conditioning. And when the patients have disease liver, or they are prone to VOD, as in thalassemics which have hepatomegaly and liver iron overload. So in such conditions, the risk of VOD is high. Or in patients who have already been exposed to inotuzumab or other risk factors of VOD. The other notable side effect of busulfan includes skin discoloration, which is very reversible, and that is one of the side effects which is reversible over time. So this was all about basics of conditioning regimen and one of the high dose chemotherapy agent in the conditioning, that is busulfan. In the next videos we will be discussing more and more agents in conditioning, and we'll also discuss about other basics of transplant. Thank you.